Hi, Stephanie here, Nurse Stephanie Victoria. I'm at Healthcare EDU. I'm going to show you how to use an AED. Healthcare EDU, we're located in Brockton, Massachusetts, 793 Crescent Street. Our phone number is 508-593-0968. Give us a call. So what exactly is an AED? It's an automated external defibrillator, okay? Now, I don't want to get too much into an EKG class, but essentially what it's doing is that your heart is beating correctly based on electricity. Electricity has to flow through the heart correctly. So we've all seen like Grey's Anatomy. When you have an issue, you put this machine on so that it could analyze the heart, and if needed, is going to shock it, give it a volt of electricity. Basically, I say like you're in a house and a plug short circuits. You walk down to the basement and you flip that switch. I'm not an electrician in the basement, and you reset it. So that's what it's going to try to do. So let's go over the pads here. You have adult pads. I say Cupid shot you with a bow and arrow through the heart. The adult pads, and the picture just tells you how it goes on. One goes on the right there. And you see you're following the picture. One goes, and your heart's on the left, it goes around. Your heart loops around this side here, okay? And this enters only one way, all right? But that's how the pads go on. Now, before I turn this on, I want to explain what you're going to hear. It's confusing for a lot of people. You have the green on-off button. You're going to turn it on, and then it will say analyzing. Now, listen, you have a victim on the ground. Something's happened with their heart. You want to analyze the victim. You don't want to touch the person and have the machine accidentally pick up your heart rhythm, because it might not give the person a shock that they need. So on the first analyzing, you're going to say clear, and you go like this, clear, everyone steps away. And then if it says to deliver shock, you're going to deliver a shock. You're going to say clear again, okay? So let me make sure that this is on. So I'm showing you this part of the video is just the AED. I will get my team here where you will see the entire basic life support. So we're focusing on the AED now. So the AED has arrived. You turn it on. Let me turn it on. Ooh, wait a minute. Okay.
This is a training device only.
It says this is training.
Will be delivered.
1 second.
Attach pads.
So it knows the pads are not attached. I will put the pads correctly. This only fits one way.
Don't touch person.
Don't touch.
Analyzing.
Clear. I would go like that. Everybody would step away. It's analyzing. We're going to wait patiently.
Shock advised.
And then now it's saying shock advised. I'm going to say clear again, because again, we don't need the electricity. The only person who needs the electricity is the victim on the ground. So here's the shock button.
Press flash shock delivered. Start CPR.
And it's going to tell you what to do, and we're going to start CPR. Now, I want to tell you something. I'm turning this off just for the sound. There's two things. When I'm teaching class, I turn it off just so I can lecture. But in real life, once the AED is on, you never turn it off. You let it stay on. Even though, hooray, the person comes to you, save their life, they could slip back into a rhythm again. So it stays on until the ambulance arrives, until the ICU, until the doctor, until whoever. It doesn't, you don't shut it off, and you don't take the pads off. Also, in class, I program it to say shock because I'm training the students. In real life, it might not always be a shock. So don't get your little trigger fingers too happy, because when it analyzes, it might only want you to do CPR again, because in real life, there's only two rhythms that are shockable. That's pulseless VTAC and VFib, okay? But that's not the purposes of this course. I don't want to go too far beyond. So those two things to remember. Once the AED pads are on, never turn it off. Even if you resuscitate the person, leave it until the doctor, ambulance, or ICU or whoever arrives. And it's not always a shock. You got to listen to the machine, because sometimes it might have you do CPR. So I hope this helps.